Hey, hello, Hannah. Thank you for joining us today.
Hi, Kartik. Thank you for having me. Excited to be
Yeah,
here.
yeah, no worries. So we're here to kind of talk about your journey, and very thankful that you want to share with the audience everything you've done. If you could just tell the audience a little bit about yourself and where you come from.
Yeah, absolutely. It's a long road to med school, so I understand it and can relate and happy to share. I know I relied on a lot of podcasts similar to this during my time in undergrad and throughout. My name is Hannah. I'm a fourth year medical student at University of New England up in Maine. I'm currently applying to residency, applying to family medicine, which is exciting. I'm happy to talk kind of all about all stages of the journey. I attended undergrad in upstate New York at Union College and studied biology and chemistry there. I knew kind of pretty early on that I was interested in pre-med. It was suggested to me actually by an AP bio teacher in high school. So I kind of don't have any doctors in my family, don't come from a physician family, but kind of started on the pre-med track early on in college and followed it through, figured out through some shadowing opportunities that that was kind of the role in healthcare that I was most aligned with and
Got it.
excited about.
Okay.
Um, yeah, and then after graduating from college, I took a job in clinical research in Boston at Mass General.
Mhm.
And there I supported the clinical research team in obstetric anesthesia, which was really exciting.
Okay.
I've always had an interest in OB and that patient population. So it was a great way to get onto labor and delivery, get some clinical experience, and get to know the patients and the medicine a bit better before applying to medical school.
Sure.
And there it was great because I was able to, publish some papers, be a part of large kind of data and retrospective projects, as well as some clinical trials. And from there, I took the MCAT twice. So happy to chat about that briefly if needed, and pushed off applying a year based on that score. Kind of retook the MCAT and then decided to apply,
Mhm.
and found myself at University of New England. So that's up in Maine. It's a osteopathic school, so I'll be a DO when I graduate. And through that experience, I have ended up taking kind of both sets of boards, both the MD USMLEs as well as the Comlex exam, which is the osteopathic exams. So for level one and step one, and then level two and step two, I took both. And throughout kind of my journey, I have been undecided kind of based on the day of the week about what specialty I would find
Yeah.
myself in. I
Uh-huh.
loved my time in Boston, seeing both the obstetricians and their work as well as the anesthesiologists and their role. I love procedures and using my hands, but I'm also, as kind of your audience will hear, a talkative person who enjoys talking to patients. And that's what brought me into medicine to begin with. So I found that I needed something with a bit more continuity and a bit more time kind of sharing, talking to the patients, in addition to loving outpatient clinic. And so throughout all of third year, I was definitely the person that enjoyed and loved every rotation from surgery to family medicine to psych and pediatrics. And so now I've decided to apply to family medicine to give me kind of a little bit of both and allow me to kind of put off making that final decision about what my niche might be.
Yeah. Wow. Okay.
Mhm.
There's a lot to unpack there. Okay. Why don't we start in when you started your med school, how was the transition for you? Was it hard going from college to med school for you?
Yeah, that's a great question. I was really intimidated by this. I think sometimes I can find myself reading different forums from Student Doctor Network to Reddit.
Mhm.
And I think the advice that I saw and kind of hung on to was that you don't need to prepare. Don't feel like you need to come in with all of this knowledge from the MCAT and that material. I think everybody has a different kind of course, minimum amount of knowledge to take and pass the MCAT and, do well enough to be accepted to medical school and matriculate. But I think I was intimidated that I needed to be prepared. And I think for my experience, orientation, they kind of level the playing field. They say these are the expectations, and like we are here to teach you this information, which I thought was really helpful. But I will say the analogy of drinking out of a fire hose, I did find accurate.
Yes.
As much as they tell you that you don't need to prepare, they will hit you with all of the information in a large volume, in a large depth right
Hmm.
away.
Hmm.
There's only so much time in the didactic years before boards to fit in all of the information that we need to learn. And I think that was most difficult in that first kind of summer. So UNE, we start July 1st
Hmm.
of our academic year every year. And I think that first summer and our first block of medical knowledge in those clinical skills classes were difficult. But I think that what was helpful was just, breaking it down piece by piece and kind of making a to-do list every day of like, what do I need to get done today? What do I need to get done this week? What do I need to study and learn in terms of number of lectures and certain content before each exam, and kind of reverse engineering it that way
Hmm.
and just taking it day by day. I think Second semester of first year got easier because you kind of knew the
Okay.
expectation. Of course, the content and the material doesn't necessarily get easier, but I think that was the part that was hardest for me was okay, this is new content, new material from an educational perspective, new medicine, and then also just a new experience.
Yeah.
And so once you were kind of once you knew what the expectations and got into your rhythm, I think it made it a little bit more easy for
Yeah.
me at least.
Got it. Got it. So speaking of that, like how you made schedules, you were planning everything out. Since you had to take both STEP and Comlex, how did that go in your second year? Was it hard to even prep for both during the school year? Were you able to do it during dedicated only? If you want to expand on that.
Yeah, that's a great point, great question. So for me, I or our school, our second year is kind of made up into blocks by systems.
Sure.
So
Okay.
our clinical skills would track with what we were learning in medical knowledge, and our osteopathic manipulative medicine would also track with that to the
Mm.
best of their ability from a curriculum perspective.
Okay.
And so I would just start doing UWorld questions. I used UWorld primarily to kind of track with the block that I was doing and help me just get more familiar with boards questions because UNE does not specifically use board style questions all the time in our first year. They
Mhm.
incorporate them more in our second year to prepare us, but the kind of advice that I had received was to start doing that as soon as possible. And so what I would do was kind of suspend or do some questions in the block that we were working on. And then as we moved to the next block, I would still try and trickle in some of the past block. And so it,
Oh,
created more and more that I was studying each block, but in terms of trying to still do review questions and incorporate what I had learned instead of just kind of leaving July and July, I would try and we started with neuro, take that through to the next month and kind of progress that way. So that
mhm.
when I got to dedicated, I was trying to do all of my question sets as completely mixed and not just focusing on like specific weak points. Of course, I would if needed, but I tried to set myself up to have dedicated be kind of
Every
everything was already reviewed and doing what I could there.
got it.
And then
Got
once I got to dedicated, I did give myself kind of a schedule of okay, if you are weak in these points in a certain subject or organ system, here's a morning or a day to review that subject. And then my goal would be to not necessarily do a deep dive on that content again. I wanted to make sure that I did hit everything, but that I wasn't wasting time. Because I firmly believe that practice questions and practice exams are incredibly helpful, especially with level one, step one being pass fail. I think you'd really just need those reps. And for me, I thought UWorld was really, really helpful. I would use Anki to kind of unsuspend cards that related to questions I was getting wrong, especially if it was a topic I was getting wrong numerous times. And then from an osteopathic perspective and adding in the level one testing, our school actually gives us or pays for the subscription to TrueLearn, which has a lot of osteopathic content as well. So I did that studying. I mean, I tried to kind of also add it in throughout
yeah.
each system, but my focus really was kind of step one content, USMLE content, with the understanding being that level one was all of that content plus some osteopathic principles.
Sure.
Um, and so I would say I probably just like binged a lot of the osteopathic principles as it got closer to dedicated. And
Okay.
we were learning them throughout the year. So it wasn't something that I felt like I needed to deep dive as hard as some of the other more difficult subjects like renal or neuroanatomy and some of those things.
Got it. Got it. So for level one and step one, is the material that similar that if you did UWorld, you could still be good for Comlex?
I thought so, yeah. And the UWorld subscription that I bought, they now actually make one that is so say when you go on to buy the level one subscription, they actually have one that's called, or excuse me, step one. They have one that's called level one, and it's all of the step one content plus osteopathic questions for OMM or OMT as they call it. So UWorld actually now has that built in.
How
I
good
just used,
do
I
you
thought
know?
it was good
Okay.
or decent. I didn't think I mean, I would say it was in the way that UWorld can often be convoluted and tricky, and we feel like they're trying to trick us. I think that held true. Sometimes the true learn questions for OMM or OMT were a bit more straightforward, and I'd say maybe a touch closer to what the actual board questions were on level one, and same thing for level two. Um, but I thought that doing it on UWorld and being able to do it in one place was helpful.
Okay. Okay, got it. And then practice test wise for level one, is there anything different or is it the same kind of?
Yeah, so they're similar to the way that you can buy the NBME forms. There's practice tests. I think they're called ComSays. Yeah.
Mhm.
So our school required us to take. I think three or four that they paid for, and we started taking them in January. So we took about one per month.
Hmm.
And that was their way of tracking our progress going into dedicated. And then I believe we had to have a minimum score, like a 450 or a 500. I think a 400 is passing for level, like the Comlex test. So we had to hit at least 50 or 100 points above that for them to give us like final sign off to sit for the exam.
Got it.
I
Okay.
think both their way of protecting their pass rate and
Yeah.
also making sure we're prepared, which in all honesty was helpful because then you were working towards that score,
Mhm.
um, even when it was just pass fail. So it kind of gave me the confidence to know that I was pretty likely to pass.
Okay, got it. And then in terms of True Learn, because I've heard a lot about True Learn, what is
Yeah.
your opinion on True Learn? Is it effective, not effective?
That's a great question. So I used TrueLearn specifically for those OMM and OMT questions for step or level one during second year. And then I actually did use TrueLearn a lot more third year than I expected to because our school paid for it again. So it was free for me. And because I go to an osteopathic school, our shelf exams are also osteopathic. So they're those shelf exams from that letter, like test writers, NBOME, it's called. Um, and so for me, it was helpful because it was more similar or more aligned to the shelf exams that I was going to be taking.
Right.
Um, so I used TrueLearn to prepare for those, but I also was kind of doing UWorld in the back just
Hmm.
to get ready for step two, kind of similar to how I had done second year.
Hmm.
During third year, I would be doing, say my block was 6 weeks for a rotation, I might do a couple weeks of UWorld questions. And then as it got closer to my shelf, I would switch to TrueLearn so that it was more worded and
Got it.
questions were structured more similarly to what my shelf exam would be. And that's kind of how I approached it. I
Okay.
felt like the TrueLearn questions were maybe a bit easier or more straightforward than UWorld.
Mhm.
And so that was helpful in the sense that I knew what to expect for my shelf exams, but also I feel like I still was prioritizing a lot of UWorld because I knew I would be taking the USMLE step two and I didn't want to be blindsided by topics or, length of question or difficulty
Got
in
it.
that way.
Okay, so the shelves for osteopathic schools are different than the allopathic schools?
They are the same content technically, and I think because of ACGME all being combined now, they have to be to a certain degree. They just add those OMM and OMT questions.
Sure.
Exactly, and it's technically a different board that's examining us. It's NBOME instead of NBME.
Okay, so like
It's the
pretty much the same
osteopath.
people
Yeah,
probably.
correct. Yeah, same content, and you still need to be able to pass them. And I think, yeah, still like a 3 or 4 hour exam at the end of your rotation.
Got it, got it. Okay.
Yeah,
Well, speaking of third year then, how was your transition studying for that? How was your transition in clerkships from second year? Was that a
yeah.
big for you?
I think it was a big jump in terms of time,
Hmm.
right? Because I think the thing I loved when looking back, I was talking to a friend about this recently. I'm like, second year of med school was the worst in the sense that it was prepping for your first set of boards and scary, but I'm like, it was also kind of the best because you weren't a new first year anymore. You knew what the expectation was, you knew your way around campus in the area, you knew what was going on.
Yeah.
And the resources that you had at your disposal, and all you had to do was kind of show up for lecture or clinical skills and like study for boards on your own time.
Mhm.
And for us, a lot of our medical knowledge lectures second year were optional and all recorded.
Mhm.
So I didn't really go in person. So I had this awesome kind of wake up. I'd still wake up like earlier, but kind of go work out and like ease my way into my day, watch my first or second recorded lecture, go to clinical skills, and then like I preferred studying into the evening versus waking up early. And I had some friends that did the total opposite. They wanted to go to every lecture and see everything in real time.
Mhm.
So I loved that control over my schedule. And then third year started, and it was like, okay, you have to be at the hospital at 5:30 in the morning. You're starting on inpatient peds. We're rounding at 6, and you need to pre-round and all of that, which is great and what we're always working towards. But I
Mhm.
think that was honestly the harder transition was just being like, okay, I don't own my time anymore. Like it's real now. But
Mhm.
I think UNE prepared me extremely well from a medical knowledge, like an expectations perspective.
Sure.
And I think passing level one and step one from a also boards and medical knowledge perspective, I felt very prepared for the expectations of me. And I didn't struggle in terms of transitioning into third year from that regard. I think I was just exhausted at the beginning of third year until my body adjusted to that schedule.
Yeah, that makes sense. It's hard getting going into third year once you're like used to having your own schedule and there's like Nope. No, not
Yeah.
anymore.
Yeah, you forget you're a med student for a second. You're like, this is
Yeah,
great.
yeah, you really do. Then speaking of which, you said you prepped for these shells. Mostly you were out doing Trulin a little bit. You adjusted to the schedule. You're going with whatever they tell you to go early, whenever. How did you prep for step two? And did you have any dedicated at all for it?
That's a great question. So something we actually gave as feedback to our school was, now that level one and step one are pass fail, and why do we have such a big dedicated there? We need more time before step two, where we're getting these scores that we're applying to residency with. It's one score. So kind of getting ahead of the answer, but yeah, no, we didn't have much of a dedicated. So our schedule does start on July 1st for every single academic year. So that includes third year, which is pretty late compared to other schools.
Mhm.
So our dedicated for level one and step one was kind of April and May, and we had to test by June in order to start third year July 1st.
Mhm.
But with that, the weeks that we are required for third year put us at finishing third year. I think I finished like June, maybe early June, and fourth
Yeah.
year would technically also start July 1st. So there wasn't really a dedicated period. It was just like, you need to test at some point this summer. Obviously, it wasn't a pass fail thing. So we were allowed to start fourth year technically without our testing being done, but then it was on you to get it done before applying to
Yeah.
residency.
Yeah, that's true.
So a little bit more freedom in that. But for me, we have such a, the way our fourth year is structured, and it might be similar to yours, is we just have to complete a certain number of weeks. And so 4 weeks of internal medicine, 4 weeks of EM, 4 more weeks of surgery, and then we do 4 weeks of osteopathic medicine. But besides those 16 weeks that have to be in those disciplines, it's just completing the number of elective weeks.
Mm.
And so because of that, I chose to rotate and to create my schedule that I didn't start rotating until August.
Oh,
So I
okay.
didn't start sub-Is till August. And then I took all of July to study for
Oh,
boards and take boards. And then I left myself like a week or two at the end to
got
just
it. Got it.
rest.
Okay.
So for me, I gave myself a 4 week dedicated just because
Uh-huh.
I was nervous and also trying to figure out exactly what I was going to apply into. And I just was exhausted after third year and wanted that break. But I have friends who tested at the end of June and, only gave themselves about 10 days or a week, and also did fine. And, they're going to finish rotating like right before match day and be done then and have the free time then. So just kind of personal preference. And our school gave us the flexibility to do that as long as you were completing your number of weeks by like whatever the end date is in April that we have to.
Okay. So how'd
So
you?
for me, yeah, sorry.
No, no, no. Go for it. Go for it.
Yeah. Yeah, no, so for me that was helpful because I was kind of using my shelf studying as like a start to studying for boards throughout the
Mhm.
year, but did not do as good of a job as I had done second year at keeping the prior rotations or those kind of questions in my studying because I think I would study for a shelf and kind of drop it and move on to the next topic.
Yeah.
So I definitely like looking back could have done better about that. I would say once January, February hit, I started doing that. Just kind of took 6 months though off of the complete kind of studying. Um, and I think studying for shells was really helpful because it kept me engaged in those kinds of questions, kept me engaged with UWorld. I
Yeah.
definitely didn't keep up with Anki in a way that I would have liked to or probably should have, kind of looking back hindsight now. So that would kind of be my recommendation for people is if you have a system that worked for you during second year prepping for those boards, try and keep it going as much as you can during third year. It's really hard because you're going to be really tired,
Mhm.
but just like having that, you know, habit in your schedule daily is only going to help you, even if you're not doing very well in the questions. It's just, I think, the practice and not letting yourself just forget it is super
Yeah,
helpful.
it's true. True. Did
Yeah.
you do Anki in addition to that?
So I was never a big Anki person during first and second year, but I actually used it kind of, I would say, decently effectively, in my opinion, during my dedicated period during second year before level one and step one. And so I would use it, honestly, I used the big like Anking or whatever it
Yeah.
is deck.
Mhm.
Um, and I would just kind of search and unsuspend by topics I was struggling with or topics I was getting wrong. I wasn't someone that had a really good schedule for getting through like the whole deck. So for me, it was helpful for rapid fire and the spaced repetition of topics I was like specifically struggling with, or drug mechanisms and farm and micro. I think for those kinds of quick recall things like farm and micro, it was really helpful for me. But in terms of bigger topics, I wasn't someone that used it religiously,
Got
and was like an Anki warrior at school.
it.
I wish. Sometimes I was like, oh, I should have started that day one, but I think I also was like, well, I didn't use it first year, so I don't know. I'm not starting
I
now,
didn't
but
either. Yeah.
yeah.
For step two and level two, was it the same type of difference as in step one, level two, level one? Was it just you did the OMM stuff, so kind of on the side?
Yeah, pretty much. I actually think that those tests, level two and step two, were more similar than level one and step one were.
Really?
I just think that like the clinical decision making, kind of those structure of questions, diagnostics, and those things I thought were more similar. I think overall, and I don't want to, not get my license by saying this, so sorry to the NBOME, but I think the consensus among DO students is that NBOME questions and Comlex questions are often kind of convoluted, and it seems easier sometimes in the question stem. And then they'll be like, oh, the only information they give you is that it's like a gram positive. And then they give you three answer choices that are gram positive bacteria with no other information of like coagulation and any other. And you're like, how am I supposed to make this choice?
Yeah.
Where I feel like on step, it's you either know the information or you don't, right? Like
Mm,
all the information to some degree is in the question stem, and it might be a difficult, like third or fourth order question, but
mm.
if you remember and recall and know the information, like you can get there. So I think that was our frustration often with Comlex is like you literally did not give me enough information to appropriately answer this question. This like I'm just gonna have to guess what you're thinking.
Yeah.
And it wouldn't be like obvious in the patient demographics or like immunocompromised state, anything like that. So that was always kind of frustrating. Um, but the questions I would say on Comlex, like level one and level two, tend to be a little bit shorter. So it's not as big of a paragraph as USMLE. So that was kind of nice. Like my timing was always way better on those
Mhm.
sections. And then the only other difference, I guess, that is major is for level one, there are 8 sections, whereas step one only had 7 and then goes up to 8 for step
Yeah.
two. So it was a longer day for Comlex level one than step one, but they were the same for step two and level two.
Oh,
Um,
got it. Got it.
that was kind of the only difference I noticed. And then, but yeah, in terms of similarities, it really just adds on those osteopathic questions, which are kind of the manipulative therapies as well as some of the tenets and background thought process of osteopathic medicine.
Okay. Another question on the boards for both the level one, level two, step one, step two. When would you recommend other osteopathic people take both tests? Like, is it back to back you
Mm,
take? What did you do?
it's a great question. Something that is often was so greatly discussed among my class in our group chat with faculty, with administration. The osteopathic schools will recommend that you take level one first. It is their priority for you to pass that board because that is technically what our license is contingent upon. So I totally understand. But I go to an osteopathic school in which most of my classmates, if not, 90 to 95 plus percent of them also took USMLE and plan to apply to a variety of specialties and wanted to be as competitive as possible. So we were all kind of toying with that. And there's kind of two schools of thought here. And then after I'll share what I did. But there was one thought that, okay, if the, science content, medicine content, farm, micro, all of these things, biochem are the same, then taking USMLE first, getting out of the way, and then like binging your osteopathic
Mm,
add-on content so that the foundation is hopefully there if you were prepared enough to sit for USMLE, and then take Comlex. So that was one plan that I actually thought I would do, but I didn't. And
mhm.
then the other one is that Comlex is technically a little bit longer. It can be more convoluted with these questions. So getting that out of the way and then kind of deep diving the NBME forms and all the other content on, UWorld and other places that really support USMLE testing. And then taking that one second. So I had initially planned to take USMLE first,
Yeah,
but I was scoring a bit higher on my level one Comlex in
sure.
like a compared kind of like Z
Hmm.
score standardization. So I was more comfortable sitting for level one first than for step one. Um, in reality, I only took them about 8 days apart.
Okay.
So it wasn't that big of a deal, but it gave me, I knew I could sit for Comlex and probably like pass and do fine. And then it gave me the freedom to then be like, okay, that's out of the way. I don't need to remember any osteopathic things for this. Take like a couple of the forms that I had left and free 120s and just kind of focus in on that question style from the NBME writers and just kind of stay honed in on that. I think most of my classmates took the tests anywhere from, I heard of some people taking them with only one day in between. and
Wow.
some people taking them with as much as 2 weeks in between. I wouldn't recommend necessarily either of those. I think like the 5 to 10 day apart is like the sweet spot. Give
Okay.
yourself like a day off to mentally just rest, but also not too much time where you're peaking for one of the tests and kind of not the other. I think if you're sitting for one, you should feel like you're prepared for both, but just structure it in whichever way feels more comfortable.
Okay. Got it. Got it.
Yeah.
Thank you.
Yeah.
For the end of this session, just wanted to ask, how did you decide on family medicine? What was your
Yeah.
thoughts going in? Because earlier you told me you had other specialties in mind. How did you decide for that?
Absolutely. Yeah, thank you. I'm really excited for family medicine. I just finished a sub-I actually yesterday, which was great, and have started interviewing. So I have done interviews the last couple weeks. I guess I've done 3 so far, which is exciting.
Mm.
Um, but yeah, so I had spent some time in OB anesthesia in Boston
Okay.
prior to medical school. My passion and kind of draw to medicine has always been women's health, reproductive care, and being as close to that patient population and type of medicine as possible has been kind of my priority. Through that, I've of course seen other aspects of medicine that are really exciting, or even things in those fields that I'm less excited about. And so with that, I kind of entered medical school thinking maybe OB or maybe anesthesia, just given my exposure. And then during medical school, loved the aspects of primary care and preventative medicine and kind of intervening before a lot of the issues I was
Mhm.
seeing happen from anesthesia perspective, like in the OR,
Mhm.
and so many cases and so many people with just really difficult health perspectives and so many chronic conditions that could be well managed if there was more access to primary care. In Maine, it's really difficult. There's truly so few physicians and difficulty from also just geographic access to care. Um, and so throughout third year, I was the student who loved every rotation. I loved my surgery rotation. I think I was the person that had the glimpse of like, oh, could this be my job? Could I do this forever on honestly every rotation? Which
Uh,
was great that I had fun during third year. But I also think it was difficult because I kept pushing off the idea that, oh, I need to make a decision about which residency programs I'm applying to in, less than a year. And so for me, it really came down to family medicine or anesthesia. I liked that both specialties gave me exposure to multiple organ systems and fields of medicine. So in anesthesia, I could go from, being on labor and delivery doing an epidural to going into a thoracic case to literally afterwards having a trauma case or a big belly surgery, things like that, with different anesthetic considerations. And family medicine, I loved that in clinic, you're really getting to know your patients. You have that longevity and continuity of care, which is what I was really missing in anesthesia. But same thing in terms of variety, that you might have a clinic morning where you're putting in an IUD and then you're talking to somebody about their new diagnosis of asthma, or somebody else is coming in with uncontrolled diabetes who hasn't been seen, by a medical provider in 5 years, and you're just like full stop trying to manage an A1C of 12,
mhm.
so I loved that variety. In addition, I also love kind of derm and some of that kind of aspect as well. So getting to do that in clinic was really fun. And I feel like both specialties gave me some hands-on procedural things. Of course, anesthesia more than family med, but I think in my decision to pursue family med, I'll be somebody who's seeking out a lot of procedures and doing as much kind of women's health care as I can. So that's been a big thing for me now as I'm interviewing, is figuring out, okay, which programs are going to train me to be able to do that and provide a broad scope of care in a future outpatient clinic
Uh,
setting.
okay. Well, thank you.
Yeah.
Last thing I'd like to ask is if you were to go back about 4 years ago, what would you tell yourself starting med school? The best piece of advice you'd give yourself.
Oh, that is such a good question. I feel like I'm not good at like thinking about these reflective things sometimes, but now that match day is coming up in like less than 6 months and we're graduating, going to be doctors, it's a good thing to think about. I think the piece of advice that I would give myself is that it's going to go by way faster than you think. That this big, daunting 4 years of medical school, which of course it is, and it's been so long and so much work, is actually going to fly by, and that there isn't one right or wrong decision about what to pursue. I think I really struggled and put a lot of pressure on myself to pick the perfect specialty and to pick, the perfect sub-Is when I was setting those up, and to pick the perfect things to feature on my ERAS application. I think just following your interests and showing up every day early, trying your best, and being prepared will carry you very, very far. and that, there is light at the end of the tunnel. The end is near, and you will get through it. So
That's
yeah,
perfect.
no regrets. Glad I did it. I think there's periods where we're like, why did we sign up for this? But now interviewing for residency, it's like, oh, I can exhale.
Good, good. That's
It's
good to hear.
nice.
Thank you,
Yeah,
Hannah, for taking the time. I'm sure the
absolutely.
audience, and there's going to be a wealth of information for them to hear from. Thank you.
Thank you. Absolutely. Thanks for having me.
Yeah, of course. Anytime. So there you guys go. That was Hannah right there. She had a great story about everything she's been through. And she was telling me how now looking back in her fourth year, she's looking back on all the hard times where she was unmotivated, didn't want to go through med school, asking why she's even here. It's all worth it at the end. It feels like, okay, this is a rewarding journey, especially when you're fourth year, when you're doing sub-Is and your specialty of interest. You feel like you're doing stuff that you're interested in and you're contributing to that. So I thought this was a great interview, great story. Hope this helps you guys, and I'll see you guys in the next video. Bye bye.